Hi, thank you for joining me today. My name's Michelle Heward and I'm a postdoctoral research fellow based in the Ageing and Dementia Research Centre at Bournemouth University. I'm going to talk to you today on behalf of the team that are listed on the slide, and I'm going to talk to you about the implementation and impact of the Dementia Education and Learning through Simulation 2, or DELTS 2 programme in acute care. So we know from research that simulation is seen as a valuable training approach for staff to gain an insight into the lived experience of dementia. And it's also useful for staff to be able to develop the interpersonal skills that are so crucial in good dementia care. However, we find very few examples of good practice in acute care of simulation-based training approaches that help to develop those interpersonal skills and gain an insight for staff into the lived experience of dementia. So in terms of the research gap, there's a need for research to determine what the factors might be that support successful implementation of simulation-based dementia training in acute care settings, and also whether that training makes a positive difference to practice. And so we were commissioned by Health Education England to develop and evaluate the DELTS 2 programme. And this DELTS 2 programme actually builds on work by Health Education England in 2013, the original DELTS programme that they created. So what is DELTS 2? So DELTS 2 is a simulation-based dementia education training programme for staff in acute care. It's been designed for those staff that have regular contact with people with dementia, and it's mapped to Tier 2 of the Dementia Standards Training Framework. And it covers 3 topic areas at Tier 2. It covers person-centred care, communication and interaction, and risk reduction and prevention. There's also a train the trainer element to DELTS 2, and that's really to support the wider implementation across trusts of these training materials. The aim of the simulation is to put staff into the shoes of a person with dementia, and that's to enable them to see the person and not just the diagnosis. And we hope that this will lead to positive changes in their practice. And this is something that we're looking at as part of the evaluation of this project, as I'll come on to in a bit. So DELTS 2 is informed by the humanisation values framework, and this is a framework that was developed at Bournemouth University, and it's within the framework there, it enables staff to be able to identify both humanised and dehumanised aspects of care and support, and that really helps to improve people's practice. So wow, what did we do? So after we created the DELTS 2 simulation toolkit of materials, back in 2017, we delivered 12 Train the Trainer workshops to 199 trainers from across England. And within those workshops, the trainers that attended were able to experience the simulations and the debriefing after the simulations as if they were the staff that they were training. So they really got that first-hand experience of what it felt like to be put in that simulation and you know how it felt and what they could kind of take from that and what they learnt from that. And after the workshops, trainers were also given a bit of time to action plan and think about how they might want to use the materials within their own training in their own organisations. And they were advised that they could adopt the toolkit as it is and use it as a whole, or they could adapt and use the bits that were relevant for their own dementia training. And so the aim of our study is to evaluate the implementation and impact on practice of DELTS 2 across England. And it's informed by the Kirkpatrick model for evaluating the effectiveness of training. And we hope to collect data that will help us to identify all of those 4 outcomes from the Kirkpatrick model. So in terms of reaction, learning, behaviour and results. So we've mapped our research objectives along with that, and so we're looking to evaluate differences in the trainer dementia knowledge scores, both before and after training, and then looking at trainers' satisfaction with the workshops and the simulation toolkit, trainers' confidence to use the training approaches after the training, and also how far and wide the DELTS 2 work has been used and spread. We also want to examine the enablers and barriers experienced by trainers when trying to implement the training afterwards, and any resulting changes or impacts on their practice. If anyone's interested and wants to know more about the study design, please do have a look at our protocol paper, which is listed here. In terms of the study design, so we collected data in two phases. In the first phase, we collected survey data, mainly quantitative. So we collected from trainers just immediately before they took part in the trainer-trainer workshops, immediately after the trainer-trainer workshops, and then we followed up with them after 12 months. And we also then in the second phase wanted to collect information from trainers in semi-structured telephone interviews, and this was 6 to 8 months after the training, and we left that period of time to be able to see for trainers to then be able to reflect on what they might have learnt, and also to be able to tell us more about the barriers and enablers that they may be experiencing. In terms of the number of participants, so as I said before, we had 199 trainers attending the workshops. 92% completed the before and after survey, so that's 183. We had 17 trainers taking part in telephone interviews, and we had 51 trainers completing the follow-up survey after 12 months. And so just to highlight some of our kind of key findings. So in terms of the more quantitative data, so we measured trainers' dementia knowledge scores in the 6 areas that were covered by the dementia training. And we actually found, as you can see from the blue box, we found that their scores increased from before to after the training, and that was statistically significant in all 6 areas. And then we also looked at whether that increase in knowledge was retained after the 12 months for those that completed the follow-up survey. And we found that that knowledge was retained in 5 of the 6 areas that we measured after 12 months. And again, that was statistically significant. In terms of where trainers felt they'd gained the most new knowledge, they actually felt that they'd gained the most new knowledge around the part of the training that focused on the humanised approaches to dementia care. So that was a section about the underpinning theory. So that for us was really valuable to see that trainers had not only taken on board that new information and that new knowledge around the theory, but they had retained that after the 12-month period as well, and using that within their own practice. So if we just have a look at some of the other statistics on the slide, so we can see there that on the whole, most of the trainers were satisfied with the workshops and the simulation toolkit. So 96% of those that completed the after training survey. And then those who completed the follow-up survey, 67% said that they felt confident to deliver dementia training informed by DELTS 2. And 45% said they were using the innovative training approaches already within 12 months. So that's really positive to see. And then just a few of the more qualitative findings. So we asked trainers to what the impact of DELTS 2 may have been on their own practice, and as you can see from the orange box, trainers really felt that there was a positive impact around their increasing confidence to be able to teach dementia, and the fact that they had adopted some of the teaching methods that they'd been shown on the training, and that they saw as a real kind of positive. Trainers, as you can see from this other quote here as well in the orange box, one of the trainers said, "It has really enriched me as a trainer. There are some very good resources which will be used." So that's lovely that feedback is lovely to see. And as you can see from the blue box, staff were also asked whether they felt that the staff they were training, whether there was any impact on their practice. And so there was a perception that staff had enhanced their practice as a result of the DELTS 2 informed training, and that staff may have been able to communicate better with patients, for example. But what, as you can see from the first quote, what the trainers had really felt that staff valued the most was the opportunity to take part in the simulation, and then the debriefing after the simulation, where they were able to deconstruct and talk about what they'd learnt, and then they were able to link that back with their own practice. And that is the part of the training that the trainers really saw the value in, and they felt was really a kind of novel aspect that didn't already happen within their existing training. In terms of next steps, so we're looking at developing an online version of DELTS 2, and we'll be exploring with e-learning for healthcare how we might package that and have that as a programme. We're also looking to explore staff perspectives of DELTS 2 and the impact on practice, and also the impact of DELTS 2 on the care of patients with dementia. So I know that particularly that last point there is something that is quite complex to measure, and so I do welcome any suggestions that anyone might want to come forward with. Please do feel free to email me using the email address listed here. Be delighted to hear from anybody that might have tried to do something similar before, or knows of any good kind of studies that have done anything before. That would be fantastic. Thank you. So if anyone's interested in having a look at the DELTS materials, please do feel free to go onto the Health Education England website. They're free to download, and with the toolkit you'll find a simulation instruction manual, so if you want to deliver the simulations you'll be able to deliver them, and there's also a slide resource pack with lots of information with all the underpinning evidence and the introduction of the theory around humanisation values framework, for example. So that's all there as part of the package, and is free to download. And I just wanted to thank and acknowledge the people that are listed on this slide for their kind of wider contribution to the DELTS 2 project. And also I just wanted to signpost you to the Aging and Dementia Research Centre web pages, these two here. So on the one hand, there's a specific page for DELTS 2. So if you're interested to learn more and keep up to date with publications that we're going to publish from the evaluation, for example, then please do keep your eye on this page, and we'll update that when that becomes available. And also, if you're interested in our research theme around innovative approaches to dementia dementia education, then please do feel free to have a look at that webpage as well. And just finally, to thank you for listening today, and just there's my contact details and the contact details of the Aging and Dementia Research Centre. Look forward to hearing from you. Thank you.